We shared earlier in the newscast that icon Celine Dion announced on her Instagram page that she was diagnosed with a rare neurological condition called stiff person syndrome. It has forced her to postpone her 2023 tour.
Yeah, we want to take a moment there and have an in-depth look into this diagnosis, and we're joined by Dr. Ritesh Ramandi, Director of Deep Brain Stimulation for Northwell Health. Good afternoon, Doctor. Thanks for joining us. Tell us a little more about what these symptoms are, and is there a mortality rate with this kind of a syndrome?
Good afternoon, and thank you for having me. Stiff person syndrome is a rare neurological condition, but it is a progressive condition. The mortality rate is not necessarily elevated, but it could cause significant symptomatology and disability if it's not diagnosed as well as treated appropriately.
Yeah, I mean, in Celine Dion's case, she says that it has affected her ability to walk, her ability to use her vocal cords the way she has in the past. So what does the future look like for her? I mean, she sees that it's a silver lining that she knows what her diagnosis is. Knowledge is power. But what does this mean for her future performances as a singer?
You know, it's difficult to say right now because it is a condition that can fluctuate, and it can present in different ways in each patient. And so it's all going to depend upon what her response is to treatment. And there are a number of different treatments for this condition, and how she responds to that will really determine what she will be able to do in the future, as well as continuing her career.
Is it possible to recover from this disorder?
Oh, absolutely. There are a few patients, a small percentage of patients that can have a spontaneous remission, but there are many patients, once diagnosed, can be treated effectively with medications, as well as those who needed immune therapy as well.
And do we know what causes it?
We don't. It remains difficult to understand why people get this level of muscle rigidity as well as spasms. We do know that there are antibodies that target specific receptors in the brain that mediate certain neurotransmitters that are associated with this condition. Also, other autoimmune disorders as well as underlying malignancies can sometimes trigger a stiff person syndrome. So all of those things need to be screened and evaluated for anyone that is undergoing a diagnosis or has been diagnosed with this condition.
Dr. Ritesh Ramandi with Northwell Health, thank you for making time with us and help us to understand